Hi, how's it going? It's good to be here. From here I can see many migrants. How odd. I was a migrant once, and I think that all of us could be migrants at some stage of our lives. Now, we know that migration benefits society, with great contributions in the labor, economic, social, and cultural sphere. Migration can even be good for people's health if they have access to basic conditions and comprehensive and friendly healthcare. But then, why should we talk about health with people who decide to migrate? The answer is simple. In our region, there are still significant vulnerabilities and injustices associated to migration that have a serious impact on the health of the people who migrate, their families, and the communities related to the migration process. Before we begin, we will talk about 3 fundamental assumptions. First, health is a human right. This is mentioned in many international treaties, agreements, conventions, and laws, which establish the right to health regardless of a person's migration status. Second, disease does not know any borders. When someone coughs or sneezes, what is least important at that moment is the nationality of this person or those around him or her. From a public health perspective, providing health care from prevention to healing to a migrant is a strategic action. As a basic principle of humanity, the fight should be against the disease and not against the person that is affected by it. Third, migrants bring great benefits to communities. In some countries, remittances are an essential part of the national economy. In receiving countries, jobs are created, cultural exchange occurs, and the economy grows. Therefore, we should also recognize that health is an excellent investment. As long as people are healthy, they can work, consume, and contribute to their communities of origin and destination. What is interesting is that, contrary to the existing myth about migrant populations always being sick, there is plenty of scientific evidence that shows that the majority of people that migrate do this because they feel fit to face that challenge. The profile of migrants includes many young people who are in good health when they start their journey. It is rather the adverse conditions and injustices they face during migration that end up affecting their physical as well as mental health. So, I insist that it should be very clear that migration in itself is not a health risk, but it definitely is a social determinant of health. The positive or negative impact on my health depends largely on the risks that I take on, the adverse conditions that I face, and my vulnerability associated to the migration cycle. And what if we go a little further? Let's be more direct. What happens when I migrate in an irregular manner? How does this affect my health? Let's start with the determinants related to my lifestyle. If I decide to leave my community, I could start to have new experiences, perhaps through risky behaviors that place my health at greater risk. And this increases my risk of getting HIV, a sexually transmitted disease, or an alcohol and/or drug abuse problem. And also, I can face difficulties at a social and community level. For example, high levels of stigmatization and discrimination because I am a migrant. This can affect my mental health, which is already vulnerable because I left my country and was separated from my loved ones. In addition, I arrive at a place where my mission is to work, regardless of the working hours, dangerous jobs, and lack of time to get health services or support. It doesn't matter if the place where I live does not meet the minimum standards of hygiene and space. My mission is to work, regardless of whether I take on risks and face conditions that make me more vulnerable to health problems. To make the scenario more complex and chaotic, there are still countries in our region with restrictive policies that make it difficult for me to regularize my migration status, and structural obstacles hindering my integration. And also, there are cultural aspects, such as language and all kinds of barriers that increase my fear of the authorities and end up preventing me from having access to basic services. As you can see, if migration occurs in conditions that are inappropriate and irregular, I take on great risks that end up affecting my health and that of many persons related to my migration process. Complicated, right? At each stage, transit, destination, and return, these determinants will be affected and will change. This makes the people that migrate and the families and communities that are linked to the migration cycle even more vulnerable to health problems. So, although I have migrated, my community of origin still exists. My family has stayed there. I know that they are sad. Family links are broken, new roles are taken on, and bonds are fragmented. And this has a high impact on the health of the entire family. Mental health problems appear. From a more integral perspective, this ends up defining, in part, the social characteristics of a community. There is also the transit phase, where, as we know, risks increase significantly according to the number of days and the means of transportation used. The migrant feels vulnerable to violence, rape, theft, commercial sex. There is constant anxiety, frustration, and fear. Finally, after a while, the time could come for some migrants to return, either voluntarily or in an involuntary manner, through deportation. And I return to a community where I sometimes feel that I don't belong anymore. I feel strange. People think I'm a loser. He didn't make it. Perhaps I don't have any access to health services. I lose my checkup visits to the doctor and could get sick. It's difficult for me to reintegrate, and I feel anxious and sad. Sometimes, returning is the most difficult phase, and what is even more complex, being able to reintegrate. Now it is clear why we need to talk and discuss the subject of the health of migrants. The importance becomes apparent to develop relevant policies, create better conditions, reduce vulnerabilities, and provide comprehensive assistance to the people that are part of this migration cycle. And that's why we are here today. According to Resolution 61.17 of the World Health Assembly, we need to improve the information systems, do research, follow up, and link national and regional information sources in order to make these populations and their health condition visible. We need to establish inclusive health services with staff that are friendly towards migrants and well-trained. And also, interpreters should be available to be able to translate if necessary. And every person needing health services should feel welcome, regardless of their migration status. We also need to design national and regional policies that facilitate such inclusion, eliminate structural barriers, and facilitate registration. We know that restrictions create invisibility, and this, in turn, creates vulnerability. We need to strengthen networks to facilitate multi-sectoral, binational, and regional interventions, and establish protocols for a joint, interdisciplinary, and comprehensive response. Political commitment and concerted participation of all involved parties will be essential to ensure this right. This seems to be a big and complex task, but we can be sure that we already have a large installed capacity, people that have been made aware of the issue, national and regional instruments that have already been established, and our best intention to improve. We are completely sure that the task is possible, and that we can achieve our objective of healthy migrants in healthy communities. And remember, this is useful for everyone. Nobody here knows if, sooner or later, it will be us or our closest relatives who, as migrants, will need to receive comprehensive health care. Bye, I'm leaving now. Thank you.